right, everyone. Well, I guess we'll get started. Thank you again for joining us today for the COVID-19 and alcohol webinar. Today, we're going to hear from two speakers who I'll introduce shortly, who will give us some insights on alcohol use during the pandemic, drawing on the results of a survey and polls commissioned by CCSA during the spring of 2020. The webinar will also highlight resources to reduce risk related to alcohol use during the pandemic. Now, first, some housekeeping items. All lines will be muted during this call to ensure sound quality. Please make sure to also turn off your videos. We will also be recording this video and will be posted on our website at a later date. We will have approximately 10 minutes for Q&A at the end of the webinar. And remember to please submit your questions directly to me during this time. We will take as many questions submitted as time permits. Any questions we can't address will be forwarded to the presenters directly for reply. Now for our introductions. So firstly, we have Catherine Paradis, Senior Research and Policy Analyst at the Canadian Centre on Substance Use and Addiction with a PhD in Sociology. Catherine is CCSA's and one of Canada's leading experts on alcohol. She joined the Centre in 2014, wanting to participate in developing and implementing alcohol-related policies at the federal level. For the past several years, she has led the implementation of the Post-Secondary Education Partnership Alcohol Harms, PAPA for short, and the development of its framework. Catherine is also one of the experts responsible for producing Canada's low-risk alcohol drinking guidelines. She is a sought-after public speaker with close to 100 media requests per year for television, radio, and print media in both English and French markets. Secondly, we have Bryce, a knowledge broker at the Canadian Centre on Substance Use and Addiction with a degree in psychology and a master's and PhD in human kinetics. Bryce is focused on improving the health of Canadians. Before joining CCSA in November 2016, he held positions at the Ontario Centre of Excellence for Child and Youth Mental Health and the Centre for Addiction and Mental Health. Bryce is a knowledge broker at the Canadian Centre on Substance Use and Addiction. He is the co-chair of the Post-Secondary Education Partnership Alcohol Harms and is involved in alcohol and workplace-related projects. Bryce also holds a degree in psychology from the University of Guelph and a master's and PhD in human kinetics from the University of Ottawa. Now I'll turn it over to Catherine to get started.
Thank you, Nina. Good afternoon, everyone. Nina, can you give me a heads up, thumbs up if you see my screen with the slide on CCSA? Good. So bear with me. I will work with two screens this afternoon. This is the first time I'm doing this. And also, I hope that we will not have any technology glitch. But just so you know, in Quebec, we have a press conference every day at 1:30, and so there tends to be Wi-Fi issue in this province around this time, but hopefully everything will go fine today. Bryce, take over, please, if I do cut from the line for a moment or so. There we go. Okay, so yes, so as I was introduced, so my name is Catherine Paradis. I'm Senior Research and Policy Analyst and Alcohol Expert at CCSA. Bryce will join me later today, but also I want to acknowledge the work of colleague Dr. Yannick Dufresne from University Laval, who helped to conduct some of the analysis I'm about to present, and also my colleague Robert Gabris from CCSA, who performed some of the cannabis analysis also for the presentation of today. So today, in the time that is allowed to me, we will present to you some results of polls and survey about substance use that CCSA has been conducting since the onset of the pandemic. So this presentation could really be defined as a scoop, or rather as a trailer. Indeed, we've only have had time to scratch the surface of these very, very rich databases. And as researchers, therefore, we feel that it is very important to let you know that these results are preliminaries, and that as we dig deeper, a complementary picture or pictures may emerge from those data. So therefore, we certainly encourage you to post questions and share with us all the ideas you may have regarding data analysis at the end of our presentation. This would definitely be helpful and could guide us with regards to our next steps. So moving here. Using evidence to inform Canadians. So first, just want to let you know why we have been collecting data at CCSA since the onset of the pandemic. So we pride ourselves at CCSA to use evidence to inform Canadians. And so since the beginning of the pandemic, we have developed resources to inform Canadians and provide them with tips and advices regarding substance use during a lockdown. We have developed resources in collaboration with other organizations like the Mental Health Commission of Canada, who were well positioned to support Canadians in this period of great uncertainties. We have also developed resources to inform stakeholders, including regulators and policymakers, to stimulate a dialogue between Canadians and stakeholders. So it is our hope that the data we have started to analyze and that we are about to share with you will help us to continue being a national leader when it comes to substance use and advancing solutions to address alcohol and other drug-related harms. So usually during those webinars, we say next slide to the person. Now I have to say next slide to myself, so sorry for the small delay. Okay, so our first poll. So we conducted our first poll between March 30th and April 2nd. So let's try to go back at the time where we were really entering the uncertainty period. At that time, we decided to survey 1,036 Canadian adults. The latter were recruited randomly by telephone and online, and the sample was geographically stratified to be representative of the whole country. In this first survey, we wanted to ask questions about cannabis and alcohol. As you know, this was the beginning. We were all wondering what staying at home, being locked at home would mean for substance use, and so we asked quite basic questions in that first nanos poll. So here's what we found. So looking at people who were reporting staying at home more than they usually did. Well, for these people, when it comes to cannabis, 9 in 10 Canadians reported that their cannabis consumption had stayed the same. There were no changes there during the first week of April. 6% reported that there was an increase, and 4% reported that their cannabis consumption had in fact decreased. So rather stable situation there. But at that time in April, there seemed to be an age effect. One result of significance was that Canadians aged between 18 and 34, so the youngest in our sample, were more likely to report that their consumption had increased. For them, it was 14%, than older Canadians, those aged 35 to 54 and those 55 plus. So really the youngest ones were more likely to report an increase. When it comes to alcohol, slightly more instability at the time, but really nothing major. Again, among people who reported that they were staying more at home due to the virus, 7 in 10 Canadians indicated that their alcohol consumption had stayed the same. So there were really no changes there for the majority of Canadians. Nonetheless, there was 18%, so almost 1/5 of Canadians who did report an increase, and 12% who did report a decrease in alcohol consumption. So really this means that in the first weeks of the pandemic, the proportion of Canadians staying more at home who reported that their alcohol use was about the same or less was 82%. Once again, there seemed to be an age effect. Canadians, the older one, age 55 years of age and older, were less likely to report that their alcohol consumption had increased. It was 10% for them, while it was 25% among the 35 to 54, the group who had increased the most, and it was 21% among the youngest drinker, age 18 to 34, who did report that their alcohol consumption had increased. Now, at the time, we had some hypotheses about why there would be a change in substance use. And so we did ask Canadian why their alcohol consumption had increased. So Canadians tended, as we had hypotheses, to say that the most common reason they gave for their increase in alcohol consumption was a lack of regular schedule. As you all remember, some of us might still be a little bit on that, but this was quite acute at the beginning. We had no idea what was a Monday or a Tuesday anymore. Weekends and week felt the same. The kids were at home. So really this lack of regular schedule led a lot of Canadians to report that being the reason for their increase. There was boredom, there was stress, that were also mentioned as reasons for increase. This was followed by loneliness and having a lot that was at home. A result of significance was that women were significantly more likely to cite stress. 57% of women did cite stress as the reason for consuming more, while for men it was just 32%. For men, it was boredom, 54% who said that boredom was the reason why they were drinking more. And for women, that was only 44%. So a gender difference there when it comes to reasons to drink more. We also asked those who had reduced their alcohol consumption. Remember, there was 12% to reduce, why it was so. And among those, Canadians most often indicated a lack of social gathering and opportunities to socialize. That was the most common response given by 61%, followed by health. Some people wanted to keep up their health in case they were going to get the virus. 12% had no reason. So women, again, there was a gender difference where women were more likely than men to cite being too busy to drink. So 15% of women said they were too busy. That reason was given by only 5% of men. And what's interesting, there's a typo here in the slide, but women more than men were likely to cite not having enough left at home as the reason why they were drinking less than usual. 24% of women said that was the reason, and that was only the case for men. Again, sorry for the typo here. At the bottom, it should be men, 4%. So a month later, between May 26th and 28th, we conducted a second nanos poll, once again with a sample of about 1,000 Canadians. This time we decided to focus on alcohol, given that the previous poll had shown very little movement on the cannabis front. So we said, well, this one, let's focus on alcohol. So the first good news that we got was that once again, the proportion of Canadians staying more at home who reported that their alcohol use was about the same or less was 80%. As you recall, it was 82% in early April. Now it was 80% who said it's the same or I have decreased my alcohol use. So we were not observing the significant increase that many of us in the field had been scared of. But so how about Canadians' patterns of use? Because for the first poll, and again, when it comes to the original questions of that one, we just asked, have you increased or decreased your alcohol use? But this time around, we wanted a little bit more details. So what were the patterns of use? How was that looking? So asked about their alcohol consumption since the beginning of May compared to the month of April, we had 77% of Canadians saying that the alcohol consumption was the same. Here we were looking at frequency. How often do you consume alcohol? So 77% said my frequency has stayed the same. There were 14% who said that they were consuming alcohol less often, and 9% who said that they were consuming alcohol more frequently than in April, in early April, at the beginning of the pandemic. With regards to changes in the quantity of alcohol consumption, so, you know, those of us familiar with the alcohol field, these are the two variables we often look at: how often you drink, and when you drink, what's the usual quantity of alcohol you use. So asked about their quantity, once again, the exact same result. So we had 77% who said their quantities of alcohol had stayed the same as in April. We had 14% who said that they were drinking less per occasion than in April, and we only had 9% who reported that they were consuming more than in April. There were no gender differences. We looked for that. There were absolutely no statistically significant gender differences. So Canadians in May were very few to have reported an increase since April, or since the beginning of the pandemic for that matter. And so this was a very good news, in fact, and maybe a testament to some of the prevention work that has been done. But does that mean that Canadian patterns of use are non-risky? Well, let's check that, because again, they're telling us that they're drinking the same way that they did before, but what does that mean? So when we look at that, when it comes to frequency of alcohol consumption, we have 21%. So 1 in 5 Canadian was telling us that they are consuming alcohol every day. So right away, these are people that we can identify as not fully complying with the low risk drinking guidelines. If you think about Canada's low risk drinking guidelines, for those of you who don't know them by heart, I wish you did, but perhaps you don't. It states in there that people should at least have 2 dry days per week, 2 days where they don't consume alcohol. Well, here we have 21% who said that they were drinking every day. And we have 18% who are consuming 4 to 5 times a week. So, so riskier when it comes to frequency of drinking. And I want to point out also that there were no gender differences when it comes to frequency of alcohol consumption at that time. Moving to quantity per occasion. So Canadian men who had reported that they were more at home than usual and who drink alcohol report that they have been drinking on average, and so if you look on the left side of the slide, 2.8 drinks in average on days when they were drinking. For women, it was 2.4 drinks in average on the days that they were drinking. So over here, once again, if you think about the low risk drinking guidelines, for men, we say that they should never take more than 3 drinks per occasion. So that looks fine over here for men. For women, an average of 2.4 means that there might be a risk that a significant proportion of women are drinking more than what we recommend in the low risk drinking guidelines. That being said, the beginning of this webinar, I mentioned that we were only starting to scratch those data, so we need to be careful. And again, if you look at the median, well, for women, it is 2 drinks. So that would be fine according to the current low-risk drinking guidelines. But nonetheless, maybe a red flag over here with women and their average number of drinks on occasion. We also looked, with the data that we had, we were able to take a look at the proportion of people who were reporting taking way too many drinks per occasion. In the low-risk drinking guidelines, again, we say that men should never take more than 4 drinks per occasion, even on special occasions like Christmas or a pandemic. But here we had 12% of men who, when asked on those days when you drink alcohol, how many drinks do you usually have? Well, we have 12% whose usual quantity per occasion is 5 drinks or more. So that is definitely concerning. We have 19% of women who report that they usually take more than 2 drinks, so exceeding the lowest drinking guideline for long-term harm, risk of chronic disease. And we had 12% who are reporting taking more than 4 drinks when they drink. So these women being at risk of both long-term harm, but also short-term harms like injuries and accidents. So this is concerning to us, and this was at the time, and this is what we had in mind when we commissioned a national survey at the end of April. And this brings us to the third survey that I would like to talk to you about today. So April 24 to 28, CCSA commissioned Léger to conduct a national survey about the COVID pandemic and substance use. So this time we had more than 2,000 Canadians who were randomly recruited from the Léger's online panel. The survey aimed to assess Canadian gambling, cannabis, and alcohol patterns of use, as well as methods of supply. Where were they getting their cannabis or their alcohol, or where were they gambling before and since the onset of the pandemic. Also, for this survey, we wanted to move beyond simply just reporting people behavior, but we were hoping to uncover possible explanatory mechanisms between the pandemic and the patterns of use of substance. So the survey focused on psychological risk factors such as stress, anxiety, loneliness, boredom, and also social and environmental risk factors, conflict with family, violence, change of routine, that were all related to the COVID-19 pandemic. In that survey, we also gathered the opinion of Canadians on the designation of casinos and cannabis and liquor stores as essential services. This seems ages ago, but I'm sure you can all recall that moment where governments declare cannabis and alcohol retail stores essential businesses. It was something we wanted to survey Canadians about at the time. So here's a snapshot of what Canadians did report. So when we look at this, so we compared their mean substance consumption since the isolation. And as you can see, for gambling, the numbers were definitely down. So the blue bars represent men, orange represent women, and the gray are for the general population. So across Canada, most casinos were closed. All casinos were closed. In some provinces, it was not even possible to purchase lottery tickets. And so not surprisingly, the frequency of gambling had definitely decreased since the onset of the pandemic. For cannabis, and I'm moving, from right to left, for cannabis, as the previous 2 polls had shown, there didn't seem to be much movement. Men were reporting consuming cannabis a little bit less frequently, but again, none of these changes were significant. When it comes to alcohol, for number of drinks, general population, there seemed to be an increase of 5%, but it was not statistically significant. And the last part of the graphs where it says alcohol, it's actually frequency of drinking. And there again, general population, 2.1% increase. So consuming alcohol slightly more frequently, but this was not significant. So really no changes apart for gambling. This is also just a different way of reporting that. So the black bars on this graph represent consumption before the isolation, and while the color ones represent since the isolation. So we see that frequency of gambling went down. Cannabis is about the same, while frequency of alcohol consumption is also about the same, at around 2 to 3 times per month. Quantity per occasion, once again, no significant changes there when it comes to the number of drinks that people were reporting. So once again, as a researcher, we were stuck with this situation where we are living something quite extraordinary. There's a lack of routine. Anxiety and stress is definitely higher than it usually is in the population. A lot of people report that they're being lonely, yet no significant changes in substance use, nothing out of the extraordinary. So once again, that led us to wonder how people were consuming before the pandemic. And what we saw, and that is quite concerning, is that even before we were hit with this pandemic, it's a third of Canadians who drink, the proportions of Canadians that are exceeding the lowest drinking guidelines, sorry, the title is wrong here, is 30%. So 1 Canadian in 3 consume more than what is recommended by the lowest drinking guidelines. And since the COVID, that proportion is at 33.7%. So not much changes, but too many people drinking too much all the time. When we dig a little bit deeper, we're seeing that the proportion of people who are exceeding since the onset of the pandemic, but not before, was 22%. But we also had an opposite movement where some people were exceeding before the pandemic, but not since the pandemic. That was at 17%. But again, for me, the striking result here is the fact that a third of Canadians do drink too much all the time. I'll do a little parenthesis here. So these results are outside of the 3 surveys that we are conducting, but I really wanted to show these data with you today. So in Sherbrooke, Quebec, where I do reside, we have been leading a research project where we are looking at the number of youth that are being admitted to the emergency room for acute alcohol intoxication and alcohol-related medical emergencies. We've been doing that. We've been collecting data since 2012, but here I'm showing you an average of the number of people in March, April, and May that had been admitted to the ER for those reasons, in average between 2017 and 2019. So let's focus on the green part of this survey, which focuses on youth aged 12 to 24 years old. So in average, we have about 12, 13, and then in May, 9 people, young people being admitted to the ED. In 2020, in March, it was only 7. And in April and May, well, according to our ethics certificate, we cannot tell you the exact number, but it was less than 5 cases. So to us, this is quite an interesting result, and it kind of indicates to us that the strategy we've been having in our community for years to focus on higher risk contexts is probably the good one. And let me explain myself. Very often when we think about young people being admitted to the emergency room for acute alcohol intoxication, we think about comorbidity. We think that these are young people who are having a lot of mental health issues, and that this might be a reason why they drink to drink in excess to a point of being admitted to the emergency room. Well, here we are in a period where mental health issues are not going down, and stress and anxiety and depression is high, but bars are closed, parties are forbidden, it's more difficult to get alcohol, and here's what we see. Well, then in those conditions, the number of young people being admitted to the ED goes down. So this shows the extraordinary power of context over and beyond mental health issues when it comes to the health of young people and the risk of drinking too much. So I'll close this parenthesis over here. and go back. So please bear with me. We're going back to the Léger survey over here and focusing on some of the explanatory mechanisms that we wanted to look at with this survey. So with a team from Université Laval, we've started to build some measurement scales. And we looked at different types of scales and their relationship with substance use in general. And what we've been seeing is that, not very much surprisingly, there's a quite straightforward relationship between experiencing negative emotions and substance use. The more people experience negative emotions, the more likely they were to report an increase in substance use since the beginning of the pandemic. So a significant relationship there. Social interactions and substance use. Again, we are in this trailer phase of analyzing data. We'll need to dig deeper, but a very interesting relationship where people who are reporting more social interactions since the beginning of the pandemic drink significantly more. Now, if you're like me, when you get those results, you're like, well, how's that possible? How are people at the period where we were under a lockdown can experience more social interaction than usual? Well, the reason is that, and you might have seen this in the media, neighbors that were organizing dinners outside in the street. You know, everyone was bringing their picnic table in the street, and a whole neighborhood would order takeout food together. So respecting social distancing, yet being together. We've also heard of people who are living in duplex and triplex and quadruplex and organizing balcony dinners with their neighbors just to have this opportunity to interact. And for some people, that meant more social interaction than usual. But for these people, it looks like this was definitely a risk factor for increasing their substance use. And another interesting result that we are seeing in our initial analysis of this survey is that Canadians in general tend to think that people have been drinking much more alcohol since the beginning of the pandemic. But they tend to have they overthink the amount that people are drinking. The perceived average is much higher than the actual average when it comes to alcohol consumption. So there's really a disconnect there between what people think others are doing and what they are actually doing in terms of alcohol consumption. And finally, when it comes to public opinion about cannabis and liquor retail stores. So these are quite interesting results that I'm happy to share with you now. So in the Léger survey, we did ask Canadians how justified it was that cannabis store had been designated an essential service during the COVID-19 pandemic. So here the slide focuses on cannabis stores. And people could give a response on what we call a thermometer ranging from 0 to 100. So if people in the lower numbers of the thermometer, that means that you're rather cold to this ID, and 100 means you're extremely favorable to this ID of, in this case, designated cannabis store, an essential service. So as you can see, Canadians did not really agree with government on that one. It's almost half of Canadians who were very cold to this idea that it was justified to declare cannabis store an essential service. We also asked Canadians not if they felt it was justified, but how important to them it was that those stores had remained open during the COVID-19. And once again, 53% of Canadians said that they were very cold when it comes to the importance of keeping cannabis store open during the pandemic. Now let's take a look at alcohol, or what I like to say, the politician's nightmare, because the picture is quite different when it comes to alcohol. there was no way of getting it right when it comes to alcohol. When Canadians were asked how justified it was to declare the latter an essential service, you see that about a third of Canadians were very cold to this idea that it was justified. But we had a fifth of Canadians who were very warm to this idea, and people in between. So there was no way of getting this one right when it comes to policy decision at the beginning of the pandemic. No way of getting it right in terms of pleasing the population, is what I should say. And same thing when it comes to how important it was. We see a third of Canadians felt that they were very cold to this idea that it was important to keep the alcohol stores open. 33.6% among women, 28.4% among men. But again, about a fifth of Canadians were at the other end of the spectrum when it comes to their public opinion of this designation. We just ran some preliminary analysis also to see if there was a relationship between feeling that it was justified to declare retail stores an essential service. And not surprisingly, the more people think that it was justified to do so, the more their substance use has increased. And that is true for alcohol stores and for cannabis stores, also the green line over here. So next step, as I mentioned at the beginning, we are now starting to analyze these data in more details. We want to look more into youth. We want to focus a little bit on women also. There's definitely a concern with women, or we have some red flags that we want to look into. And we also want to continue to dig into, since the beginning of this presentation, I've been saying, well, there's a lot of stability. Canadians do not seem to have increased their alcohol use as much as we would have expected. But nonetheless, it's about 20% who did so. So we cannot say that that is not concerning. We just want to figure out in more detail what that means. People who have been drinking more, is it, once a week more with just a glass of wine, or is it really higher quantities on every occasion? So we'll need to continue to analyze those data. And in the meantime, when it comes to providing advice to those who feel that they might have been drinking too much since the beginning of the pandemic, or that have been increasing their alcohol consumption since the beginning of the pandemic, we do have tools at CCSA. And I will let my colleague Bryce Barker take over here and share with us one of those great resources that we have available to all for that purpose.
All right, excellent. So thanks, Catherine, for all that and really excellent information. So I will share my screen. Just one moment, bear with me. Let's see. So just coming back, setting this up. So Catherine, you're on video. Can you give me a thumbs up that you do see the beginning of the presentation and that you hear me okay? Thumbs up. Okay. Oh, thumbs down. Okay. And let's see. So you can't hear me, Catherine?
Hi, Bryce. It's Nina. You're just cutting out a little bit.
Let's see. Yeah. Okay. So I'll try again. Is there anything, is it still okay? Is it coming through okay? Yeah, okay. A thumbs up from Catherine. Nina, hopefully thumbs up. So, resource, when Catherine was talking about where we are right now in terms of the pandemic and the way that people are drinking currently, it's important to note that 1/3 of Canadians who are drinking beyond Canada's lowest alcohol drinking guidelines. So within that group, some people do have a severe alcohol use disorder that does need treatment. But for a lot of people, they might be drinking just slightly beyond Canada's low risk alcohol drinking guidelines. And so the resources that they need are more in terms of public education and self-help resources, or potentially something they could use with a clinician that's less intensive than treatment. So the resource that I'll present, Knowing Your Limits with Alcohol, a practical guide to assessing your drinking, really complements public education, complements the low-risk alcohol drinking guidelines that Catherine touched on. While I'm speaking about the resource, I'll try to highlight just how this can be used by individuals, but how this can also be used with a clinician in different clinical settings, or by your organization to encourage people to think about their alcohol behavior, potentially making a change. So the resource was developed by David Brown of Pathways Research. So David consulted with motivational interviewing experts in Canada and with my organization, CCSA, during the development of the resource. And we were happy to be able to make the resource available to stakeholders free of charge after 2019. So in fall 2019, we're able to put this out. So again, the guide is a small guide that can be printed off. It features tracking for 1 month. It helps people to think about their relationship with alcohol and think about making a change. So it's self or clinician guided. It is no substitute for assessment by a clinician who is trained. It is no substitute for treatment by a medical professional, especially for people who have a more serious alcohol use disorder. So motivational interviewing is a person-centered counseling method that can be used to help people make a health behavior change, including in relation to substances like alcohol. The goal of motivational interviewing is to help people think about a change, to explore change, and to build motivation for a change. It's an evidence-based practice in the treatment of substance use. And there's continues to be texts and studies, so it's a continuing area of study, but very promising and very strong evidence that this is a useful resource. So the first part of the guide is really focused on helping people to think about their relationship with alcohol, to think about some general information related to alcohol, about the health effects of alcohol, about standard drinks. So without the concept of a standard drink, no one's really able to have a good sense of how much they're currently drinking. There is an opportunity to set goals, to track, reflect. There's encouragement throughout the resource. And one of the reasons why this is a good accompaniment to a clinical intervention that's informed by motivational interviewing is that all of the information you need about alcohol is here. So this resource can really be a play-by-play and provide that information, especially if a clinician is looking at other health behavior changes. So if you're a doctor, a primary care physician, and you need to talk about many different subjects, or if you deal with other substances, and you don't have the information about alcohol on hand, this is an excellent resource to have that information on hand and to share it and maybe work through with someone, the client or a patient, work through this resource. But again, someone can also just pick this up and go ahead and work through it themselves. So this section, the first section of the guide, really encourages people to think about their drinking, think about their relationship with alcohol, to learn about what a standard drink is. There might be a few people who are calling it internationally, so Canadian standard drink looks a little bit different than some other places, same as the United States. There is a two-step self-assessment within the guide, and this self-assessment is really based on counting your standard drinks usually consumed each week. It does line up with Canada's low-risk alcohol drinking guidelines. So the more you drink, the more your total score becomes. And then there's self-assessing harms. So your motivations for drinking and harms that you've experienced based on the World Health Organization assist. So the alcohol substance use scale assist. So again, based on this scale, it's no substitute for assessment by a trained clinician. So one thing I would note is just that if someone, you can see on the right of the slide, you can see that if someone comes in high, there's a little bit more text, high risk. So the idea is that if someone comes in high risk, we're encouraging them to go see a physician, to seek help, because they could be experiencing some pretty severe consequences from their alcohol use. So the other levels, medium, marginal, low, we emphasize that this could be a good resource for them. For medium and marginal, we're highlighting that a person might experience some harms from alcohol in the future. The next section looks at alcohol and health. It highlights the major health risks of drinking. So again, just this resource to have on hand to talk about all of the different effects of alcohol on liver disease, diabetes, heart disease, stroke, cancers, and mental health. So again, that's for a clinician who wanted to work with someone, this is an excellent resource just to have all of this on hand and not have to try to dredge this up in memory. The next section looks at setting goals. So the goals are personalized so that if someone, they might be coming in, as Catherine mentioned earlier in her slides, so someone's drinking every day. They might be drinking beyond Canada's low-risk alcohol drinking guidelines. They might be drinking in a risky way. So there are a number of options that are very flexible for the individual, so that they can think about what makes sense for them. What's a goal that makes sense for them to change their behavior for 1 month? So this might include stopping drinking altogether, taking a break for 1 month. People are probably familiar with dry months. So again, this guide is essentially if someone talks about a dry month and has interest in taking a month off, this is what this resource can do. It can be used any month of the year. So take that break for a month, cut back on drinking, so specify how much. So again, if someone is drinking beyond Canada's lower alcohol drinking guidelines, it might be feasible for them to cut back, but still be above the drinking guidelines. Or if someone's within Canada's lowest alcohol drinking guidelines, and they still feel that they're having some negative consequences from their drinking, they all drinking guidelines. And then finally, if someone wants to carry on drinking, that can be a goal. And while it might not seem terribly useful for someone to do that with a resource like this, it can be an opportunity for someone who's not ready to make a change to consider all of the health risks of alcohol and to consider their relationship, to consider the situations that drive their drinking. So it can still be a very useful resource for some people who are thinking about carrying on drinking for that month, but are still going to use the resource and track and work through it. So there are some additional tips before people kick off tracking for the first 2 weeks. So these are common to Canada's low-risk alcohol drinking guidelines, and there's a few additional ones. So planning ahead for situations that might come up, so potential barriers, thinking about alternatives to drinking, some tips that people can do to moderate their drinking, so pacing, eating food. So really thinking about these pieces before they get started, and encouragement to ask for support from a doctor, nurse, friends, or family. So after that, a person begins by tracking the first 2 weeks of their alcohol consumption. So after the first 2 weeks, there's some space for people to reflect on what worked, what didn't, what situations contributed to their drinking, how they can continue to work towards the goal they set at the beginning of the month. The image on the right is an exercise that is in the workbook. So someone thinks about what they want to have at the center of their life in a holistic way, and where does alcohol fit into that equation? So again, just thinking about their motivation, building that motivation, continuing to build motivation. Self-reward, so there's an exercise of thinking about how much alcohol costs you regularly, and then potentially a reward that you can get for yourself for achieving your goals, so based on the amount of money that you're saving every month. And again, re-emphasizing those sources of support, sometimes outside of the family, that might include a church or others. So after the final 2 weeks, there's a bit of a section just to debrief, to think about changes moving forward, to reassess. So go back to those reassessment based on how much you're drinking per week and some of the harms that you're experiencing. So thinking about that and maybe seeing if you've moved down a level. So maybe if you're at moderate risk, you've gone down to mild. So you might have moved down a level. So there's more information that's provided, some resources that people can use, and encouragement to connect with a nurse, with a doctor, with family and friends to continue to think about their relationship with alcohol. So that's the end of the guide. I wanted to emphasize a few times throughout, but this is useful in a clinical setting where I have all this information and basically a script that mirrors motivational interviewing. But again, there's no substitution for a brief intervention, a clinical brief intervention delivered by a trained staff. However, it's a good, useful resource to have on hand that can help to accompany those types of interventions. There are a lot of uses that you can think about this resource for in the community. So again, you might link to it through your website. Just make sure that people have this information. It's always on hand. There's uses on campus. So Catherine and I involved in the Post-Secondary Education Partnership on Alcohol Harms. We really see the use for this on campus and in different treatment settings as part of an integrated system of talking about substances, thinking about screening and brief intervention. This can be a very complementary resource. So the guide itself is available at our website. So that's the link. If you want more information or if you want to give us some feedback, you can email me. If you do plan to print and distribute the resource, we appreciate if you fill out our permissions form. We're really interested in continuing to track the value of this resource for people. So that is it. So I'll hand it back to Nina. And I'll just play around with my settings here. Stop sharing. There we go.
Perfect. Well, thank you again, Bryce and Catherine. We have some questions here. And so I'll go off. Let me just start off here. The first one that I've got. So could the reason why the numbers of young people being lower in 2020 is also because people do not want to go to the hospital due to the presence of COVID-19 at the hospital?
It could, although I would doubt so, in the sense that usually these are rather extreme cases. Speaking with the pediatricians who are working at the hospital, it's really much more a case, and we've been documenting this for years. We do know of specific high-risk moments in our community. We are aware of specific high-risk locations in our communities, and all of those were unavailable at the moment. So prom been canceled, the bars were closed, the street in Sherbrooke where most of young people coming to the ED come from, all of these venues were closed. And while it is of course possible that young people were still meeting in basements and drinking too much, even though that was not permitted, it's the reality is that the big change was with regards to the availability of contacts, of high-risk contacts to drink. So we're quite confident that that's the reason why the numbers are lower, and not that people did not show up to the emergency room.
Thank you, Catherine. That actually leads me to the next question. Were there any significant differences between provinces in your data analysis?
We have not come to that yet, but we've not done sophisticated analysis yet, but at a first glance, there was nothing striking that jumped at us.
Okay. And I guess, considering the results of these surveys, do you think we can anticipate the same patterns for wave 2 of COVID? And do we foresee any increase in the fall or winter months when people are more likely to stay indoors?
Your guess is as good as mine. I mean, really for us at the beginning of this pandemic, we had identified loss of a routine, increased stress as major reasons why people would drink more. So what would it be this time around? Maybe that now people are more organized to work from home if there's another lockdown. So we could say that, the effect might not be as pronounced as the first time around. On the other hand, we could say, well, it was fine once, but we're not ready to do this twice. So what will this mean? There's also, seasons I would feel could have an impact also. It's one thing to be locked down in March and that spring is coming and you're being optimistic about going out at one point, but going into phase 2 possibly in the fall, knowing that you'll be really inside, it's cold. We can speculate about this all day long. None of us have experienced this before.
No, definitely agree. Thank you for that. I'm just getting questions here left and right. Have you been able to explore insights regarding race and ethnicity when it comes to drinking and COVID-19?
No, not yet. Not yet. Again, you just got the movie trailer of those data. It's a trailer.
Okay, I'll keep going with the questions because they're just coming in. Now that places are beginning to open up, are you going to continue with the study to see if there's any increase with more availability again?
Yes, I do know that CCSA will continue to survey Canadians. We are collaborating with the Mental Health Commission of Canada also to do additional surveys. I don't know, Bryce, if you have more information than that about perhaps the dates of those new surveys and polls.
No, I don't have any additional information right now, but yeah, we definitely are continuing to do work in that area.
Okay, fantastic, which actually leads me to the next question. Has any analysis looked at whether people who have mental health problems were drinking more or less?
So we did not, our survey aimed to be populational. So we couldn't dig so deep, we didn't have access to a clinical sample. That being said, you may recall that some of our preliminary analysis are showing that folks who reporting experiencing negative emotions. Negative emotions is a scale that was made of 7 items, if my memory serves me well: anxiety, depression, fatigue, boredom. So people who were experiencing more of these negative emotions were significantly more reporting an increase in their use of alcohol, cannabis, and illegal drugs than those who were not reporting those negative emotions. So there definitely seems to be an association there.
And one thing I would add is just that Stats Canada has some research that they put out in the field as well that reinforces what Catherine's saying. So just that lower self-rated mental health and increased use of substances. They included tobacco. So I think those findings are out there as well.
Sounds good. And has CCSA have any plans to explore the use of substance use beyond cannabis and alcohol, such as methamphetamines?
Yes, we in the Léger survey, we did ask questions about the use of illegal drugs. There's a lot of people on this presentation, but I think I saw my colleague Matthew Young somewhere, and I do know that he's been tracking the use of illegal drugs since the beginning of the pandemic. So Matthew, I don't know if you're there, and if you are, you may manifest yourself. But that's definitely not my field of expertise, but the simple answer to the question is yes, we did ask some questions about that.
Hi, yes, hi, thanks Catherine, thanks for the presentation. We put our Sendu network put out an alert back in April looking at the changes in the illegal drug supply and the impact of COVID on the illegal drug supply, and we found that the drug supply is becoming more unreliable and more toxic, and we also indicated that this combined with a lack of kind of harm reduction services and access to services like drug checking services, supervised consumption sites, and things like that, which happened early on we're contributing to a greater number of harms associated with illegal substances. But I encourage you to look at on our website under our CCENDU, Canadian Community Epidemiology Network on Drug Use. We also produced an alert on methamphetamine, or not an alert, but another report on the impact of methamphetamine use on COVID. So there's some resources there, but thanks. I hope, contact me if you feel like learning anything more. Thanks. Thanks for the presentation, Bryce and Catherine.
Perfect. And I think we have one other question, the last one for today. And somebody had asked, did the survey look at awareness of the CLRDGS?
Awareness of what?
Of Canada's low-risk drinking guidelines, maybe. I'm filling in the blanks.
No, the survey did not ask specific questions about Canada's low-risk drinking guidelines. We do know from previous survey that awareness of the guidelines is rather low across the country, except in Quebec, where awareness is almost at 70-80%, I think. But elsewhere in Canada, it's more around 20 to 30%. So it is rather low. There's definitely work that needs to be done with that. And Nina, I know you said it was last question, but also thinking also about what the previous questions that I've had and moving forward and what will this mean. There's also how people will adjust in terms of their substance use behavior if there is a second wave or when there is a second wave. But one other thing also that I would invite people to start thinking about, and that we're definitely looking at, is, as you may recall, since the beginning of the pandemic, we've been witnessing a lot of policy changes when it comes to the sale of cannabis and alcohol. It's much more readily available if we think, for example, about online ordering or delivering at home, or restaurants being able to sell alcohol for takeout. So we might not be seeing the impact of these policy changes right now as we speak, but there's definitely a concern that once, the toothpaste is out of the tube, it's tough to put it back in. Will we revert to what alcohol policies were before the pandemic, or will these liberalization of alcohol policies and cannabis policies stay the same post-COVID? And that's when we might start to see some impact that could have significant impact on the health of well-being and safety of Canadians. So that's another thing that we're keeping on the back of our mind. It's really a complex situation with a lot of we have a lot of balls in the air looking at this issue.
Well, thank you so much again, Catherine and Bryce. Thank you for the information that you've provided us. I'm sure this will be very helpful for everybody. I think this is all the questions that we have now. And so if anybody else has any questions that we weren't able to answer or see in the list, please, send it over to us, send it over to my email, and I'll make sure to pass it on to our speakers. Again, thank you, everyone. We appreciate you being here, and have a fantastic afternoon.
Thank you.
Perfect. Thank you so much.
Thanks so much.